Good morning, and thank you for joining us today. My name is Dr. Libby Saunier, and I'm the Executive Director of the Louisiana Policy Institute for Children and co-chair of Geaux Far Louisiana. Geaux Far Louisiana is a coalition of parents, child and family service providers, and child advocates. Geaux Far Louisiana believes in an equitable, unified early childhood system, centering racial equity and ensuring families' access to seamless, high-quality early childhood development, health, and educational services. We are excited to share with you today the results of a statewide poll of likely voters about different issues that impact families in Louisiana. The poll was conducted by New Bridge Strategy and included 600 likely voters in Louisiana, with an oversample of 123 likely voters with children ages 5 and under. I will be your moderator today, as different members of Geaux Far Louisiana share the findings from the poll and highlighting support among Louisiana likely voters for implementing paid family leave and medical leave, expanding resources for families, increasing the minimum wage, and increasing state investments in early childhood care and education. Throughout today's program, I encourage you to utilize the chat box to share any questions you have. There will be a dedicated time at the end of the event for a question and answer session, where we will attempt to answer all your questions. It is now my pleasure to introduce Stacy Russell, Deputy Director of the Louisiana Budget Project, a nonpartisan nonprofit that monitors and reports on public policy and how it affects Louisiana's low to moderate income families. The Louisiana Budget Project is a member of Geaux Far Louisiana.
Thank you, Libby, for the introduction. It's an honor to be with you today to discuss the serious issues facing Louisiana families. This poll shows that likely Louisiana voters strongly support implementing paid family and medical leave programs. Almost 80% of voters support requiring employers to offer paid family and medical leave, and 71% support an employer-shared cost model for the program. Right now, Louisiana has no program to guarantee paid family and medical leave, though the State Civil Service Commission recently approved a proposal that would allow all classified state employees up to 6 weeks of paid leave following the birth, adoption, or foster care placement of a child. This is a great start, but this is something that all Louisiana families need to thrive, regardless of where they work. We hope candidates and eventual elected officials pay close attention to these polling results and what voters are hoping to see in the future.
Thank you, Stacy. Next, I am pleased to introduce and welcome Shalina Davis, Chief Executive Officer of the Louisiana Public Health Institute. The Louisiana Public Health Institute is a nonprofit that champions health for all people within systems in all communities. Shalina holds a master's degree in public health and social work from Tulane University and a bachelor's degree in psychology from Xavier University.
Thank you so much for the introduction, Dr. Saunier. It's an honor to be with you all today to discuss the serious issues facing Louisiana families. 78% of voters identified workplaces without flexible policies for parents to take care of health and caregiving issues as a serious problem. When we break that down by voters who are also parents of young children, the number is even higher at 83%. When workers have to choose between their family obligations and their finances, they are forced to make difficult decisions. But we could implement policies that would make those decisions and choices easier. Nearly half of voters who have left the workforce entirely or know someone who did to care for an elderly or relative with a disability. Approximately half of voters have postponed necessary health care or know someone who has because of cost or lack of insurance, with even higher numbers among parents of young children. Wouldn't it be better for all of us if people didn't have to choose because they had resources available to them and flexible work policies that allowed them to return to their jobs? These are complicated issues, but the voters care about them, and we believe that together we can find solutions.
Thank you, Shalina. Next, I'm pleased to introduce and welcome Frankie Robertson, founder of the Amandala Group, which works with organizations that address the social and political determinants of health that directly impact health of Black birthing people. Frankie is a member of Geaux Far Louisiana and is the parent of 2 young children.
Thank you, Libby. This poll provides crucial information from voters at a critical moment for our state. Currently, Louisiana has the highest rate of maternal mortality in the country, an abysmal figure, well, not a figure, an abysmal reality, and one that we should all be working tirelessly to address. Over 80% of voters see a need for more support for pregnant women and new parents. This includes 84% in support of providing more education and skills to new and struggling parents. Additionally, 85% of voters support ensuring pregnant mothers and new parents have access to medical and mental health care for themselves and their young children. And 82% support expanding resources for mothers and new parents, including prenatal care. When parents are able to thrive, babies are more likely to have a better health and life outcomes. Isn't this what we all want and hope for?
Absolutely, Frankie, and thank you. Next, I'm pleased to introduce and welcome Ronnie Sloan, president of the Sloan Group. Ronnie, you're on mute.
Sorry about that. I was the first one to do that. Thank you, Libby, and everyone, and I'm so honored to be here today. Currently, Louisiana has no state minimum wage, meaning our minimum wage is set by the federal government at $7.25 per hour. This figure in itself has not been updated since 2009. Obviously, we all know that you cannot support a family in Louisiana on $7.25 per hour, not even with 2 parents working together to make ends meet. The majority of voters in Louisiana see the need for the increase in wage, with over 2/3 supporting gradually increasing the minimum wage, the state minimum wage, to $15 per hour. Our over half of Louisianans live in poverty or paycheck to paycheck. These polling results recognize that voters understand we want our elected officials to do more to support working families in the state.
Thank you so much, Ronnie. Next, I am pleased, we were hoping to be able to introduce Rochelle Wilcox, who is the owner of Wilcox Academy of Early Learning, co-founder of For Providers by Providers, as well as the inaugural 2023 Early Childhood Leader of the Year, but she is stuck in travel woes, so I will pick up from here. So what we know is for years, advocates like Rochelle and I have urged increased investments in early care and education as a way to prepare young minds for lifelong success and support the workforce. I'm pleased to report that according to this poll, voters strongly support dedicating an additional $115 million in state funding per year for the next 10 years to expand early care and education programs for working families. This support includes 62% of Republicans and 95% of Democrats. Early care and education is truly a bipartisan issue. Nearly 80% of likely voters across Louisiana think taking action to ensure that more working families have access to affordable, quality childcare should be an important priority for our state in 2024. Louisianians really want public policies that support working families. This poll shows that voters clearly support common sense solutions for the greatest issues facing young children and their families. Now, I'm pleased to introduce Con Yin, a parent and member of Geaux Far Louisiana, to talk about the mission of Geaux Far. Con?
Thanks, Libby. I'm so excited to be a part of Geaux Far and what we're trying to achieve for Louisiana and its families. The latest polling data shows that over 75% of Louisiana voters want candidates to support policies that put young children and their families first. All elections are important, but the 2023 elections are particularly crucial. Louisiana has made great strides in recent years for its families, but we have so much more to do. I hope candidates will take this information seriously and commit to listening to voters about what they want their elected officials to focus on. Geaux Far Louisiana has identified 5 goals to create an equitable, unified, child and family-centered early childhood system that centers racial equity and ensures families have access to seamless, high-quality early childhood development, health, and educational services. The 5 goals are a family and provider-driven system, a net that works, a healthy start, childcare for everybody, everywhere, and family-friendly workplaces. We believe that as we focus on these 5 pillars, we can create a better Louisiana for everyone.
Thanks, Con. And fundamentally, the name of Go Far is not by accident. We know from the proverb that it comes from, if you want to go fast, you go alone. But if you want to go far, you go together. And we want to go far for Louisiana's children. We really thank all of you, the presenters, our board members, media members, candidates, partners for participating in this important discussion. Again, we know that we have to be able to go far for little people and their families together. We will now transition into question and answer portion of today's event. And if there are any questions, please put them in the chat box. I just saw one come through, and Frankie, I'm gonna hit it to you first. If we think about Louisiana's maternal morbidity and mortality numbers, what do you think the greatest issues are facing our Louisianians, and what are potential policy implications for these rates?
Sure. I think the greatest area that has the majority of touch points to address maternal health outcomes is addressing economic justice issues, making sure that families can provide adequately for themselves and for their children. This also transfers to the area of issues of paid family leave and the ability of families to have the proper time to heal from a pregnancy, a birth, and for that family, that mom, that birthing person to transition to the either new area or lifestyle of motherhood, or modify their existing family structure to welcome additional children, which is always a changing dynamic as well. And to have the necessary stability financially to be able to provide for their families and for their health and their mental health, having undergone such a transformative process, such as pregnancy. So if we address the root causes of economic injustices, that addresses a pretty hefty part of what we're seeing in relation to the maternal and infant health crisis. But if we also look at the obvious issues that exist in terms of broader issues such as access to care, meaning from an institutional standpoint, that there are a lack of medical facilities to provide for some of our most rural parts of the state who need the same care, and also some of our urban metropolitan areas where there are still access issues. Those are two of the key items policy opportunities I'd like to uplift today.
Thanks so much, Frankie. And the questions are pouring in, so bear with me. For Ronnie, if you're still available, how do you think childcare impacts businesses and the ability for our employers to find workers?
Well, thanks for the question. It definitely impacts businesses. When we think about the fact that we're talking about minimum wage here and gradually increasing it, there's this term out there, livable wage. So if you've got employees that aren't able to cover the basics, if you will, then most of the time people say basics, they're talking about housing, food, and transportation. But when we unpack basic, we know that childcare is an extremely important part of it. So having being able to put your child in very effective and caring situations so that you can go to work, employers would have less maybe absenteeism. It would also impact the fact that folks will have a sense of satisfaction about going to work because they're able to take care of their families. They're able to go beyond the basics. We have 1.7 million households in Louisiana, and 51% of them are below ALICE. And ALICE is the acronym that is used throughout the United Way of asset limited, income constrained, employed, the working poor, if you will. So we have folks that need, 2 full-time jobs, which also impacts childcare, just to equal a living wage. So if you've got 2 full-time jobs, you're not able to care for your kids as best you can. And then that also impacts your work, but it also impacts the health and welfare of those students and those kids.
Thanks so much, Ronnie. I'd also like to kind of uplift what Ronnie was talking about our ALICE community. And sometimes we call them our communities that are paycheck to paycheck. So if you
Yes.
think about our ALICE community or paycheck to paycheck plus our poverty rate, that's about 52%. So that means these people are our neighbors that are struggling and need support. And so that's over half of our Louisiana population. And so that makes the work of Geaux Far Louisiana and all the organizations that are on this webinar today so critically important as we really work hard to center young children and their families and to make sure that they have what they need. For Stacy, for you, do other states have paid family and medical leave? And is Louisiana an outlier for not having such a thing?
Hi, Libby. Thanks for the question. We've seen some great progress over the past few years. We're now up to 13 states and the District of Columbia that have elected to establish statewide paid family medical leave programs. They're funded through a small payroll contribution that's generally shared between employers and employees, and it covers both the arrival of a new child as well as family caregiving. Perhaps a spouse or a parent receives a diagnosis where they need care at home, and also medical for oneself. Perhaps a worker gets a diagnosis that requires some time away to heal and seek treatment. And what we see is that it helps keep people connected to the workforce. It increases morale. And in the states where these things have been implemented, we've also got some really good evidence of outcomes before the program was implemented and outcomes after. And what we've seen is nothing but good. So we've got lower rates of neonatal and neonatal and infant mortality rates go down. Postpartum depression goes down. RSV hospitalization rates go down. So if Louisiana wants to join these other states in going in the right direction, paid family medical leave is a proven policy to do that.
Thanks so much, Stacy. That's really helpful. Shalina, I had a question come in related to, we know that many parents are not taking care of themselves because they're not able to take time off. How does stress of working and caretaking affect parents? And what are some public health solutions that we might consider?
Sure. Thank you so much, Libby, for that question. And I think, stress, like all of us, individuals and parents, can impact our overall health and well-being. Stress causes cortisol levels to go up in our body. That's the hormone that can be good if we need to push ourselves. However, if it's prolonged, it can be very detrimental to not only our mental well-being, but our physical well-being. So it's very important for us to kind of be aware of that and also help support our families in reducing that stress. I think that some of the public health strategies that are out there to kind of address that include some of the policy levers that folks have already mentioned with paid leave, because if you're worried about economics, if you have to take care of your child or a loved one going out of work, we can put things in place to kind of help support them on the economic front. I also believe there are other public health strategies like education and training of our parents through things like mental health first aid, so that we can equip parents and their family members and community to understand how to address, stress and mental health. And also, if they need to, be able to refer them to, a provider out in the community, either through like a community health center or a mental health provider that can provide them with services based on their ability to pay. So I'll stop there and see if folks have any other questions.
Thanks so much, Shalina. And I think that really hits on the same points, some of the main points that Frankie made too, and shows the interconnectedness of the work that we're really all pushing for with Geaux Far Louisiana, to make sure that families do have a net that works. And that net that works looks like many different things, from paid family leave to lactation support, to making sure that parents and providers have a seat at the table for decision-making abilities, and fundamentally making sure that when we're talking about minimum wage, what does that look like? Which then leads into another question I just received. It says, good morning. What is considered a livable wage today for childcare professionals? And so since Rochelle's not here, I will take that one. And I would say we're to a point now that we're not talking about livable wage, because really. And so what we're really now talking about is competitive wage. And competitive wage obviously is not $7.25 an hour when a childcare educator, a teacher, could go and work at Starbucks or Target or somewhere else and make a minimum of $15 an hour with benefits. So what does a competitive wage look like? It means that, our teachers that are in the early care and education field can meet their household needs and not be as vulnerable as the children that they're caring for. It also means that they would have access to a bevy of benefits. And so we at the Louisiana Policy Institute for Children are digging into competitive compensation and wage for our early childhood professionals because we know that they're not babysitters, that they are really architects of the brain. Thank you for that question. Well, we have cleared through some questions, you all. Thank you so much to everybody for joining us. Again, thank you to our presenters, our Geaux Far partners, the team at the Louisiana Policy Institute for Children, and many, many others. We know that this is important work and that Louisianans are asking what they need from elected officials. And so we again thank you to all of our presenters and for you attending. If you have any questions or would like more information about Geaux Far Louisiana, please email info@gofar.org. We'll make sure we put that in the chat box for you. And to read the full report and learn more about the work related to Geaux Far Louisiana, you can go to www.gofarla.org. Again, thank you so much for being here today. We appreciate your participation and look forward to engaging with you all in the future.